Hi, I'm Jeff Boyles, Fire Chief for the Newport Beach Fire Department, and we're here in the Emergency Operations Center, otherwise known as the EOC, located at the Civic Center here in Newport Beach. Our EOC has been activated for the COVID-19 pandemic since Sunday, March 15th. The EOC is where all of our departments come together to organize a unified and coordinated response for our city's resources. EOC has been operational Monday through Friday from 8 a.m. to 5 p.m. And I'd like to pull back the curtain a bit and give you an inside glimpse of what goes on day to day inside of our EOC. EOC staff and department directors gather 2 to 3 times a week for an 8:30 morning briefing to review our incident action plan, or our IAP as we refer to it, which gives us details on how each department will coordinate their efforts with the upcoming days. As part of my duties as fire chief, I also serve as the incident commander inside the EOC during this pandemic. Now, what that means is I'm in charge of the operations section, the planning section, the logistics section, and the finance section.
The city's EOC is activated to respond to COVID-19, and while we're activated, what we're doing here is responding to all community and employees' needs. So in our city's Emergency Operations Center, we are planning for not only what's going on today for COVID-19, but also tomorrow, next week, and next month, and how we get our city ultimately back together to recover. We are going to take a tour of our city's Emergency Operations Center, talk to city staff, and talk about what their role is during COVID-19 to help support the community and employees in the city of Newport Beach. What you will see today is we're showing you an example of our Emergency Operations Center briefing that happens every day at 8:30 a.m. What you will see is a few of our EOC staff members who are in the room, but you won't see is most of our EOC staff members and department directors will be reporting in, practicing social distancing, and telecommuting. During the daily EOC briefing, each department gives a report on what is going on in their department and city staff.
My name is Mike Alcide. I'm the planning section chief. I'll be conducting this morning's briefing. Just a reminder, we're to strongly encourage all city employees to be wearing face masks whenever you're out of your office in contact with other employees or the public. Here's an interesting, we're looking at the data, part of the planning section, we look at the data, and we have a spike in positive cases, but it seems to be every Wednesday. And so I think that's an artifact of some way how they test, but you look at all the peak days seem to be on a Wednesday. Total people tested or hospitalizations, we're continuing to show an increase in the total number of people hospitalized over the last week to 10 days. But fortunately, the rate of people in the ICU is not nearly as steep. The cases here in Newport Beach have plateaued since the early part of the month. This is an interesting dashboard from Johns Hopkins, and this breaks down quite a bit of data. Wow. But it gives pretty detailed information, and it's available, and we'll include it in the incident action plan today. Our objectives are here. They're static for today. We'll probably look and evaluate some of those objectives for going into the weekend. Here's our staffing for the EOC today. Reminder, maintain 6 feet of social distance. And if you're sick, please do not come into work. Our weather today, we're expecting to continue the warm weather and heat advisories. And we'll have warm weather through the weekend with a little bit of relief with a marine layer through the weekend, and then continued warm through the rest of the month. We'll go ahead and start with our reports with our Director of Emergency Services.
The good news, I think, is that our city council is very supportive of the plan that we have. You know, there's a lot of discussion of should we do more here, should we do less here, you know, so that will continue, and I think we'll just have to continue managing that balance.
We are taking our lead from County Public Health and from the governor. So everything we talk about in our policy briefings, we're trying to stay in line with both a reasonable approach as far as outdoor activity and economy, but also safety of our people.
Thanks, Mike. So a couple things we've been picking up in terms of our calls for service and our actual call volume, and a lot of that's with the weather. There's more people out.
Morning, all our staff is up and running, no sick reported. All our contractors have been coming to town. They're reporting in, which is good news. We're getting our full share out there. Staff's busy maintaining our traffic control enclosures and various barriers out in the fields and signage.
I just wanted to add, we've been tracking our phone calls that come in every day by type. And our average day for beach-related calls is 0 to 5, and yesterday we had 17. The good news about that is we educate people when they call what the rules are and to practice social distancing. So we're just continuing to keep an eye on that in the field and see how the weekend goes.
Good morning. This is Anthony from the logistics section. Just a quick note for the departments and the sections out there. We still have possession of sanitizer, gloves, and face coverings. So if you or your staff need to have any of these supplies, feel free to route them through the logistics section and we can meet those requests. Thank you.
The other issue was face coverings for essential employees. So now all employees that have some contact with the public are required to wear face masks in those essential businesses.
A couple thoughts starting at the federal level. The CDC director made some comments yesterday about the second wave of the coronavirus, and that is expected to be the same time as the flu, so that will create future challenges for us. At the state level, the governor made comments yesterday. There is no date set to reopen, and the indicators need to be placed for testing, contact tracing plans they're putting together at the state and county levels. And then also the governor gave an executive order yesterday, amended to allow hospitals to start back with necessary surgeries. At the county level, we continue to push 211 Orange County, so that 211 is the call center for people who need assistance, so food and different types of assistance that they cannot get other places, 211 Orange County, as well as Orange County has an economic and financial business recovery line. They've already taken a couple thousand phone calls, and they're translating in, I think, over 25 languages. So that's at the county level. Today, the county has changed their conference calls, so there will only be one county conference call on Thursdays at 1 p.m. each week. That's at least for the near future.
Chief, can you please tell us about the police department's role in COVID-19 and our response here in our EOC?
Well, certainly our role in this has really been to make sure that the governor's order is being adhered to within the city. And we've gotten some really good compliance on that. Our businesses and our community, frankly, has been understanding and have been responsive to our education efforts. And we've everybody understands that we're in a unique environment right now, and we're really trying to focus on keeping our community safe and healthy. And that's what our position is here in the EOC, is really not to necessarily as a police-led operation. This is more of us as being part of the city team and making sure that we're all focused on the mission of keeping our community safe and healthy.
And Chief, I know this has been so challenging because it's not like our regular disasters we face, that this is an ever-changing emergency that changes daily. Can you talk about just a little bit about the challenges that you face as far as keeping police department staff safe during this time and also following through with all the regulations and new things that come down each day?
What our role is here is to make sure that we're keeping up with the latest information that's coming out. And as Katie, as you mentioned, it is coming out quickly. And so for us, it's important that we get that information to our first responders on the street and make sure that we're supporting all the efforts citywide that are being undertaken in our community.
And Chief, I know these are unprecedented times and so different from your normal operations. And I know that we are all in this together. And thank you so much.
We certainly are, and again, for us at the police department, it is really important that we are here and we're coordinating with all of our partners, all of our directors, from Parks and Recreation to our partners in Public Safety, the Fire Department, to Marine, but also our logistics and our planning team are critically important to this organization and the way this is being run as a city.
Hi, I'm here with Public Information Manager John Pope. John, can you tell us a little bit about our operation here in the EOC and why it's so critical that we are communicating so effectively, not only with our community members and with our city employees during this time?
Sure, Katie. Well, one of the things that has been developed on a national level after 9/11, when FEMA began to create the incident command system, was that the public information officer role was right central in the command structure. And that's because there's a recognition that information is a critical part of disaster response. And so my role in this, the COVID crisis, has really been to try to digest and get as much current, important, verified information as I can and let the public know what they need to do to keep themselves, their families, and their communities safe.
And I know there's so many ways for people to get this information. So what primary methods are we using here in the city to communicate with the public?
Mm-hmm. Well, one nice thing about having everyone home is people are very plugged into social media. So we're utilizing our social media channels, Facebook, Twitter, And Nextdoor has also been a very powerful local tool here in Newport Beach. We have a very engaged community on that platform. We also use our website as kind of a central source of information. So if people go to newportbeachca.gov/COVID-19, they'll get right to our page that has all the latest information, as well as our current news releases, links to public health agencies, and really everything that you need to know. We have an updated Q&A there. And then also we have an e-blast that goes out to subscribers. So we've asked people to come to our website, sign up for our e-blast, and that way every time we post something on the website or we have a new message to communicate, we make sure that they get that. So and then also we have the good old-fashioned phone system. We have a lot of people here in the city who are answering phones and coordinating information and making sure that we have a staff that's able to answer those questions for the community.
And talk a little bit about the public information piece as far as coordinating with how we coordinate with our county, state, federal partners. I know that you participate in lots of joint conference calls daily, I'm sure, because this information is changing so rapidly.
Yeah, Katie, that's a really important point. And early in the crisis, we were getting different information and different messaging almost every few hours. Things were changing and evolving very rapidly. And the crisis response continues to evolve. So it's been very important to stay in close coordination with our county partners, with our state partners. And the county, in fact, has had a daily conference call with all the public information officers, communication staff throughout the county to make sure that we have an opportunity to hear the latest and best information from the county public health agency, and then also answer questions about the individual local response from the cities.
And such an important role in public information will go on for so much longer, even after when people are able to gather again. There will be so many things and so many requirements and limitations. So this is definitely going to continue on even after our Emergency Operations Center closes, just the continuing conversation with the public as far as keeping social distancing and what they can do to protect one another.
Yeah, that's a great point as well, Katie, because disaster response does not just stop the day that the EOC closes. There's a recovery piece to this, as we all know. The direct impacts to businesses, I think, is where, and financial impacts are where people are focused now, getting our economy back. But there's also going to be a psychological piece to it. And as people, it's going to be very difficult, especially if, as is being discussed, we can't just green light everything right away. We need to kind of do a phased approach, and we may have to, take a couple steps back occasionally before we can take a couple steps forward. So those pieces of communication are going to be very important for the public to know what they need to do to make sure that they stay safe.
We're here with Logistics Section Chief Anthony Nguyen. Anthony, can you talk to us a little bit about your role in the EOC? Logistics is so important as far as supplies right now for COVID-19. Can you talk about what your role does for the city?
Sure. So my role as Logistics Chief for this EOC response has been to supply protective personal equipment for the EOC sections and departments. And so you're talking things like face masks, cleaning wipes, gloves, cleaning solutions, anything that we previously really took for granted, before this disaster broke out. And so one of the challenges during this response period in this EOC actually has been getting, your wipes and your sanitizers, because we're dealing with such a nationwide shortage. No one can really find these things. And so it's a matter of leveraging relationships with vendors, trying to be creative with the solutions. One of the benefits that we've noticed is that some of the community members and businesses have really been creative with trying to help us out. Two examples include, sailboat companies, instead of manufacturing sails, turning their production lines to then make masks. And then we also have distilleries converting their production lines to make hand sanitizer instead of alcohol. And so it's been nice to see the community, be creative with solutions to help us address this disaster.
And your role is so important because as employees are required, they're essential workers and required to be here at work, providing them with essential personal protective equipment during this time is so essential. Can you talk a little bit about you talked a little bit about the shortages, but also how we're forecasting, how we're looking ahead and not knowing how long COVID-19 is going to go on for, and how much personal protective gear and what a balance that is for your role in the city?
Definitely. So the major challenge with buying PPE, for this EOC response really is that this disaster isn't, it's not localized, it's not regional, it's widespread, it's national. And so you're dealing with, a constrained supply chain trying to get these goods, not just for this response period, but for the time thereafter. No one knows really, when this is going to wrap up, when we're going to decelerate in terms of cases. And so the need for PPE is this constant moving target that we constantly try to hit here in the EOC. And, I think we've done a good job here in Newport Beach about not overbuying or not, hoarding supplies. We're buying as we go. We're buying as we need. And I think that's a direct result of us leveraging, positive relationships with our vendors so that we're not constantly scared that supplies are going to run out and that we can be confident that we'll secure goods whenever we need them in a timely fashion.
Such a critical role you play as far as getting people what they need and our employees, keeping them safe and keeping them safe going back to their families as well. It's so important. We're here with Sean Levin. Sean is the Care and Shelter Director in the EOC. Sean, why don't you tell me a little bit about the Care and Shelter branch in the EOC and how COVID-19 has changed our traditional planning for what Care and Shelter is?
Sure. Well, this is a curveball. Usually we're training for disasters where we'd be opening up a shelter. Fire, earthquake, flood, things of that nature. So we're planning for bringing people together in spaces in great numbers, and this is the opposite. So we've changed our focus, and it's more how do we get services to people who need them as they're sheltered in place. And a large part of that has been our senior population because they're at risk with this. So that's what we've done. Our meals delivery per day, we were at about 40 Meals on Wheels per day. And with this incident, we're up to north of 200 per day now. So that's been a ramp up. Also finding any needs that seniors need, toiletries, masks, anything of that nature to keep them safe. We're filling that need.
And you guys are doing such a good job as far as filling the needs and also keeping people engaged. I know that you have a call center that people can call in for other services if they need mental health or other services during this time. And then also keeping parents and kids at home busy while all of these parents have their kids at home and might be doing homeschooling, as keeping them active. Can you talk a little bit about the resources that you have both to support the seniors and to support the young and families at home?
Definitely. I know you have kids at home like I do, so we know this well. The kids still need an outlet and need some sort of a recreation. I know parents do to help fill the day. So we've created, our staff has done an amazing job and ramped up an online recreation center that you can find on our website. And there's actually classes. We've got our class instructors that typically teach in the field. They're offering classes online now and all different varieties of classes. So there's fitness, there's art, there's enrichment. So you can go on and check it out and see what we've got there.
That sounds great. And then looking long term, what can we expect? I know this is an ever-changing situation, and I know that you and your staff are being so flexible as far as trying to meet the needs now, but also trying to forecast the events as well for the future. So can you talk a little bit about your staff and the daily situation and just kind of the briefing of where we're looking for summer and fall? Are we going to be able to do rec activities, or are we just still waiting for the governors and other orders to make those decisions?
Well, that's the big question, right? Everybody asks that question. We ask it of ourselves too, and we're following the lead of the governor's order. So we've been measured in what we're closing and how we're closing it, and we're following that order and coming up with contingency plans, whether we come back in a phased manner or how that goes. So we're working through that every day.
Okay, can you talk a little bit about some of the online classes that you have in the variety? What can our City of Newport Beach residents expect during this time?
So we have some really creative instructors, and they've come up with, I'll share two really neat classes that are being offered. One is an art class where you'll actually drive by the art studio and pick up a package of supplies and then go home, and the class will be virtually taught online with the supplies that you picked up. And similarly for cooking, one of our instructors is working on a cooking class where the same would be you'd pick up a package of food and then go home, and then she would lead you as a chef on how to prepare that meal and learn to cook.
Wow, so creative, and I know you have the most creative department and minds working on all these classes. Can you talk a little bit about the summer classes, and will there be more interactive classes, or that's to be planned and discussed?
Yet to be determined. Registration is open for summer. If you do register and whatever happens, whether we modify summer or we can't do summer, hopefully that is not the case. It's the worst thing that a recreation person can think about is canceling summer. So we don't hope that's the case, but if it is, we'll be giving full refunds. So just know that.
I'm here with Life Safety Specialist Matt Breezeway. Matt, your role in the EOC during the activation is the liaison officer. Can you tell us a little bit about the liaison officer and what your daily role here is in the EOC?
Sure, Katie. So as the liaison officer, I report directly to the incident commander along with the PIO and the safety officer, and I'm responsible for coordinating with the county and other outside agencies our response to COVID-19. In Orange County, we utilize a system called Web EOC that all counties, municipalities, hospitals, schools, water agencies, and others are on, that we update our status on a daily basis. We enter our press information, we do our resource requests and other things so that the county can monitor what we're doing here in the city of Newport Beach. It also provides us with a written record of what we have done in terms of our response to this COVID-19 incident. So we're entering things on a daily basis into the Web EOC, and as well as you know, your position and others are also entering things in, so we keep track of the records. But as a liaison officer, my primary responsibility is to coordinate with the county our response in terms of what we need, what we're doing, and what issues the city of Newport Beach is facing.
And talk about, since the COVID-19, things are changing so quickly. So as new health emergency orders are put out, as new state orders are put out, as you receive them here in our city's EOC, what do you do with that information, and how does it get percolated up to the policy group and also out to the community? How does that process work?
So information, as with this incident, has been coming in very, very quickly, and it's been rapidly changing. And as it does, we are monitoring everything here in the Emergency Operations Center and making sure that our policy group, our incident commander, our emergency manager is aware of some of the things that are going on, so then we can make decisions based on the most up-to-date information. So we do participate every day in a 1 o'clock conference call with the county, in which we get updates from the Orange County Healthcare Agency, the schools, and other resources here in Orange County that really help dictate our decisions in terms of how, as a city, we're going to respond in terms of closures, masks, other type of things, and really the dissemination of public information. So it is truly a coordinated response from the state level, the county level, and the local level to make sure that we're giving the best information out to our residents.
And how does that look long term? So as we get into more of the recovery mode, how does the liaison role work with the businesses, schools, and others to make sure that they are staying up to date and also staying protected and also following those orders as the governor rolls out? How does the liaison officer help facilitate that?
So one of the roles of the liaison officer has been working with our logistics chief, and our logistics chief in terms of requesting resources to make sure that we have enough PPEs for all of our first responders and our frontline workers. As we start this entire process of reopening, that will really be one of the challenges in terms of coordinating with the county and our incident command group, our policy group, with exactly how we're going to start this reopening process and let the public know about what they can and can't do as we start opening up our parking lots, our beaches, our city facilities, the public gathering spots, what really is going to be the expectation of the public, and that will all be dictated in our case by the Orange County Healthcare Agency and the county in terms of giving us guidance and how we interpret the guidance and then disseminate that information to the public.
Okay, we're here with Public Works Director Dave Webb. Dave, can you talk a little bit about your response here during COVID-19 in the EOC? Talk a little bit about that, but also talk about how this is different than our regular planned response for what Public Works would be doing in an earthquake or other type of disaster.
Yes, thank you, Katie. Dave Webb, Public Works. It is a little different. Our typical response, we would plan for something like an earthquake or something. We'd see a lot of maybe infrastructure breaks, facilities broken, maybe damage and issues that we have to address, but we're not seeing that in this particular type of event. We're seeing a lot of issues in regards to health related, where we have to maintain social distancing and trying to help people be educated that they need to do that, and blocking off areas that are in high demand or folks who aren't necessarily practicing that, and kind of giving a structural block for that. Other things we're doing out there just in this event, we are keeping the city functioning and keeping it rolling because we need to keep all our essential assets and infrastructure in good shape. But we're also taking opportunities at this time in this event because we have the opportunity to get inside, like painting our facilities inside when people aren't there, restriping some parking lots and things where they're closed right now, and we can take the opportunity to take care of it because it's really hard to do when there's people in those areas.
And speaking of the beach and different closures, talk about the coordination, and it's a daily situation, ever-evolving situation, that there are different closures in different areas, and talk about how we work with other cities and counties based on our closures and our decision-making in order to close those areas.
Thanks, Katie. Great question. We work daily with all the other department heads and some of our city conference, excuse my mask, as we discuss in the morning some of the areas of need, maybe where people are gathering, maybe where we're getting a lot of residents' concerns, and they call in, and then we talk with our other department heads and figure out the best way to do that while addressing their issue, but also maintaining the ability for the public to access certain areas. And We work with the county folks. We listen to the county directors during the day. We discuss that as a policy group. All the department heads meet every morning, and we discuss tactics on where's our next areas we have to address and how to best do that.
And so long term, when we start opening things back up, I mean, how do you envision your operations working with our residents to inform them that these areas are open, and how does that work for our staff rollout as far as removing some of the barricades, opening up the parking lots? How does that impact your staff and operations?
I think the way that's going to work for us is that as we get the direction to move, that we'll kind of go in a reverse order. When we put the facilities in place, we work with the residents. We told them what we're going to do. We put out proper signage, and then gave them some notice, and then we implemented some closures. Some we had to do relatively quickly and might have surprised people. We tend to do it in the mornings before the crowds get there. I think on the reverse side, as things come out, we'll let them know. For instance, we have several walkways closed right now. We'll probably give them some warning that we're going to start to do this, and then we'll take them down in pieces and slowly dismobilize things as we mobilize.
We're here with City Manager Grace Leung. Grace is the Director of Emergency Services. And Grace, can you please talk about your role as Director of Emergency Services and the daily operation here in the EOC and your role?
Yes, absolutely. Well, as director of the EOC, I want to make sure that we're coordinated and working all together. We have a lot of different areas that we got to make sure that we're responding to, and so I want to make sure that the resources are there and that we're coordinating and working amongst each of the groups well together. Also in my role here, I want to make sure that the executive team, our department directors, are working together, and I communicate information to them. And in addition to that is a really critical part is with our city council. They are our disaster council. They set policy. I want to make sure I'm communicating with them of what's happening in our EOC, and also to implement any policy direction they are providing.
And this emergency is so unique because it's changing daily. There's no borders, there's no boundaries, unlike earthquakes and other natural disasters that could impact us. Can you talk a little bit about how you work with the other city managers in the county as well as the Board of Supervisors and collectively in Orange County making decisions for our city based on what other cities are doing and working together?
Yes, that's absolutely such a good point, really, and I want to emphasize that we really take our direction from the state, who has set the governor's orders there, and we want to make sure we're following those. And also with our county, they have the public health department, and they are really provide the expertise in this area to provide that guidance. So we want to make sure we're in line with them. You know, our Orange County, we're very blessed to have, we have 34 cities, but they operate very well together. We have a set of our city manager group. We talk weekly together, and we share information. I, in fact, created a spreadsheet for our city managers to work together to know what different cities are doing, so we're reacting in a coordinated way the best we can.
And I assume as we go forward and the governor issues the order to reopen, that will be the same coordinated approach in Orange County and all the cities that working together to when and if we can reopen our facilities, and how that works as far as future social distancing and events and things like that coordinating at a county level.
Yes, absolutely. We do want to have that coordinated county response. Of course, each city has their own characteristics and things that they have to be mindful of as they look at those orders and changes. But to the extent we could be united and working together, that will just make us stronger in our response and ensuring that the virus doesn't come back.
And let's talk a little bit about our businesses in our community. I know that you have such a tough job working with the Chamber of Commerce and other organizations to help support the businesses. Can you talk about a little bit about how working with the businesses for reopening and just how we're ongoing communication with them and how important it is during this time with so much information out there and them not knowing when they can reopen and when things get back to normal, so to speak?
Yeah, I mean, certainly this global pandemic has hit everybody, and we're extremely concerned and sympathetic for particularly our small businesses in our community, of which we have so many, and they're such an important fabric of the city. So we really are wanting to work very closely with them. Our mayor has, in fact, he's put on the next council agenda to look at having a business reopen committee to be really focused on looking at how we can help our businesses get back going as soon as they are able to. That's why we've also taken a lot of time. That's why our EOC has really been managing on this response to find that right balance of ensuring the safety of our community, but also not completely shutting down if we don't, in areas that we don't need to ensure that we can be up and running as quickly as we can. So we are very mindful of that. I think this committee that the mayor is putting together will be very helpful in providing that support, and I know the whole city council is very interested in figuring out ways that we can assist businesses any way we can.
We're here with Chief Jeff Boyles. Chief Boyles, can you please talk about your role here as the incident commander in our city's Emergency Operations Center, how the fire department is the lead agency during COVID-19, and how that's so different than normal wildfire response and some of the other issues and things that we've planned for, fires per se, and now we're talking about a health emergency and how different that is.
Sure. We opened up our EOC on March 15th. I'll never forget that day. It was a Sunday afternoon when City Manager Grace Leung called in the department directors, and we watched the governor speak live, and that's the day that he closed the bars and the restaurants and wineries and breweries and different things of that nature. Hence, changed the landscape of our city for quite some time to come. At that moment, Police Chief John Lewis and I decided to open up our EOC, and Katie Ng here has a very robust plan and does drills with us and training and planning throughout the year. And typically we train for tsunamis and earthquakes and natural disasters, and we try and figure out how we'll come together as different departments to work collaboratively with regards to emergency services, but there's also utilities and public works and park control and recreation. And then there's a big financial component of tracking everything that occurs as well and our expenses that happen throughout the event. Now this one in particular, a pandemic, falls squarely under the fire department to take the lead role because of the medical component. We have it lined out in our emergency operations plan. If it's civil unrest, traffic control issues, rioting, things of that sort, that the police will take the lead. If it's fire-driven, then the fire department will take the lead. So in this case, I've been the incident commander from the fire department standpoint because of the medical-related component to it. A lot of our response has been driven around the COVID responses of whether people are sick or symptomatic and we have to get them to the hospital, but also the larger global component was the policy decisions on whether or not to close things, whether or not to keep things open, such as parking lots, the amenities at our parks, our beaches, and how to keep the rest of our community safe from those that are symptomatic and are infected.
And can you talk a little bit about coordinating with other fire departments in the county and how collectively you guys are working together to make sure that not only you're responding to the community, but also keeping your personnel safe in the station so that they are safe on calls and so they don't bring it home to their families as well?
Sure, that's a really good question. I'm actually glad you brought that up because we have a county component here where we're operating under the county public health guidelines, which are ultimately operating under the governor's guidelines, and the governor is operating under the President of the United States. So there's a trickle-down effect where we're all trying to coordinate our efforts. Strictly speaking in fire department terms, we're having county conference calls. It was daily, it's moved back to weekly with the county fire chiefs and how to coordinate our efforts with auto and mutual aid and different modalities for medical components, if you will. We've had to change the way we approach some patients. We've had to change the way we treat some patients. We've had to change the way we enter into our emergency rooms with our paramedics and our patients. But then there's the component where the EOC brings together all the different county components. So there's a public health component, there's a financial component, there's a coordinated effort component, like I said, with the finance. Katie's on the phone with the County Department of Health on a semi-daily basis. Our liaison officer is working with the county, and we have the police departments working with the various police departments, but then they have to work with the county as well. So behind the scenes, I think this is a good opportunity for us to demonstrate how much coordination goes into an actual decision that's being made or a practice that's being made.
And since you're so closely connected with our local hospitals, for community members, if people that do think that they have symptoms, if they have symptoms or they have a family member that has symptoms, what is our recommendation that what they do? Do you want them to call 911? Should they go see their medical provider? It's probably a good opportunity to remind our community members what we encourage them to do if they feel that they have COVID-19 symptoms.
Sure, and we're taking our lead again on that one from our medical experts over at Hoag Hospital who have been doing press releases and interviews with some of our council members and trying to get the message out that our emergency rooms are still open. If someone's experiencing chest pain, stroke-like symptoms, shortness of breath, by all means, you need to call 911 and you still need to get the medical treatment that your body needs. I've been to the emergency room over the last several weeks. I check in, and quite frankly, they're much reduced in numbers right now. I don't want to say empty, but they're lower. And that's a result of normal day-to-day activity not occurring. People aren't driving cars and getting in car accidents. Sports have been eliminated, so we're not seeing the collarbone fractures and the ankle injuries and just the day-to-day injuries that do occur when people go outside and recreate and do different things and go to work. However, it's very important that if you are experiencing some sort of illness that you feel is life-threatening in any way, that 911 is still available and the emergency rooms are safe and they're still open.
I'm here with Chief Mike Alcide. Chief Alcide duals roles here in the city of Newport Beach. He is the lifeguard chief, but he also is our planning section chief. Chief Alcide, can you talk a little bit about the planning section, how it has evolved in COVID-19, how important it is that we put together plans for our emergency operations center during this time?
Certainly. So the planning section is responsible for developing an ongoing incident action plan, taking in information and helping run some of the functions of the EOC or Emergency Operations Center in terms of making sure that everyone, their actions are coordinated, that everyone is sharing the best information out there, and so that all our actions are really coordinated and we're doing the greatest good for the greatest number of people.
Okay, and while we're talking about those incident action plans that the planning section's putting together, can you talk a little bit about the resources that it takes to put those together? Also the sources of information. There's so much information during this time, how you put together a plan that's cohesive, brief, but also gives the main points not only at the federal, state, and local level, but also our city level and what we're doing here in the city of Newport Beach?
Certainly. So the planning section, we've practiced and drilled for many different events. This is not one, well, we understood a pandemic could happen, so we had to create some of our process. It's much different than if it was an earthquake or fire or flood. And so we've been using a variety of sources from the University of Washington to the Centers for Disease Control, the Orange County Department of Health, and really putting together all the information, the models. Every day during our briefing, we present what the current state is, what we expect the next 24 to 48 hours to bring. We really bring together information from each of the different branches. They'll each supply 204, which is a form. It talks about their actions, talks about what their expectations are, any special directions from each of our operational branches. And it's as diverse as the fire department, recreation and care and shelter, public works, our harbor department, our police department, all the different branches working together to put their information. In the planning section, we have a documentation unit that helps with that, a resource status unit that helps put all that information together into a cohesive package that we'll send out at the start of each operational period. It's been a challenge. This is not something that we were drilled and skilled on, but we've really gotten much better. We've figured out which sources provide the best, most salient information for us. And really, we're looking to provide everyone in the city actionable information, data that can help them drive their decisions.
And let's talk about also about the recovery piece. While we are still in the response to COVID-19, talk about as the governor lifts the order and the county lifts the health order, how does that impact our operations in the planning section and in our EOC as far as recovery plans? Recovery is such an important process and long-term process, and how does the EOC plan section support that process?
Yes. So most people think of response to a disaster as the initial phase of the response, but once we're out there, we go through a recovery stage, demobilization, and then finally mitigation of what we can do. So the planning section, we're involved in each of those as we go through. We're currently still in the response phase, but we're already starting to look in our advanced planning towards the recovery and the demobilization. What is this going to look like as we start opening up areas? What other implications in our business community, in our social community, in our community at large? All our businesses, residents, visitors, how is this going to affect them, and what plans we can do to get Newport back to where it was, and in some ways hopefully better than it was prior to this outbreak. So I'm here with Dylan Biggerstaff, one of our seasonal ocean lifeguards. He's served the public for 5 years, protecting the visitors and residents of Newport Beach, but he's been tasked to work in our Emergency Operations Center. Dylan, so what have you been doing in the EOC?
So basically, as you said, I'm a Newport Beach lifeguard, and you'd usually find me out on the beach, but I've been studying emergency management in school, and as Mike said, I'm now working in the Emergency Operations Center. So I've been doing everything from logistics and dispersing supplies, packing PPE, and now I'm moving on to documentation and planning and helping to make sure everyone has a safe and healthy place to work as far as sanitizing equipment, and I'm excited to see what's next.
You know, most people, I think, are surprised that we don't have a dedicated staff, but it's just part of being an agile response is that we have people from recreation, from the community development, from public works, all working together in different roles. Dylan, what's the most surprising thing you've seen here in the EOC?
Yeah, so as Mike said, a lot of us are bouncing around in positions that are new, and I've been in the emergency response for this city, and I'm really excited to be working here. And I'd say the most surprising thing is just how encompassing the operation is here and how far-reaching the decisions are and how important your individual decisions each day are and how big of a difference you can make for this city that we all live.
Hi, I'm Matt Breezeway here with the City of Newport Beach, and we're in our city's Emergency Operations Center, and I'm serving as the liaison officer, and I'm here with our city's Emergency Services Coordinator, Katie Ng. And Katie, you've been responsible for this center and all the way from its inception, from its ground up, from the building of it to the creation of it and everything else. And since we've been activated here for COVID-19 since Sunday, March 15th, I imagine you've been fairly busy in terms of getting everything up and running. Can you tell us what some of the things you've been doing and how this center has really been operating?
So our Emergency Operations Center, how we've always prepared is our Emergency Operations Center is ready 24/7 to respond to any type of emergency. Obviously, COVID-19 is a little bit different than the natural disasters and man-made that we plan for, but nonetheless, our EOC is always ready. For COVID-19, actually, we started planning for COVID-19 in January. So fortunately, way back from 2009, we had an H1N1 disease outbreak plan that we adapted for COVID-19 back in January. So we have been planning for this event for quite some time. We didn't realize, I don't think anyone did, how big this event would become and the closures and just all the different impacts and unfortunately the deaths that have occurred. I don't think anyone truly could plan fully for that, but we have done our best. And prior to COVID-19 and the closures, we actually did a drill in our Emergency Operations Center. We had a tabletop drill with all the city department directors, and we went through the scenario and talked about if COVID-19 got worse, how that would impact our city operations, financially, staff-wise, all of those things. We did a drill about 3 weeks prior to the governor issuing the stay-at-home order.
And Katie, I imagine for this pandemic incident, it presents some really interesting challenges for you and for the city's Emergency Operations Center. This center is designed for 38 plus employees to be here working hand in hand collectively with a lot of human face-on-face time with departments really collaborating together. And with the nature of this event, I imagine people have had to be separated and really minimize the number of staff that are in here on a day-to-day basis. Can you tell us how you've really addressed those challenges in the long run in terms of how we've really used telecommuting and logging in and web EOC and things like that?
Our EOC activation and our response has really evolved just like the situation has evolved. So when we initially activated, we had just the department directors and a few of our key EOC staff. And then we did bring in some more people before the stay-at-home orders were issued. But then we had to look at it really quickly and identify that we also have to keep ourselves safe to go home safely to our families. And we definitely do not want to spread the virus. So what we did is we implemented a lot of telecommute meetings, go live, things like that, so that we didn't have to have everyone in the room, everyone who plays a role. Normally they would be in our EOC for face-to-face, just like you discussed. But now our briefings look very differently. We have a few people in the room just to operate the briefings, and everyone else is remotely in order to keep those social distancing rules and adhere to that, and to keep our employees safe. So the challenge still remains to keep the EOC activated, keep our functions in the EOC going, but maybe just not the city employee might not be in the room physically because of the social distancing rules that we need to adhere to.
So I imagine there's lots of emails, conference calls, things like that with not only city employees, the county, the state, and other things that are going on a day-to-day basis here in this room.
Yes, and so the situation has been changing. It changes weekly. So we are constantly in constant contact with the county. The county's Emergency Operations Center has been activated since March 15th as well. We are also doing daily communications with them, Orange County Healthcare Agency, all other surrounding cities, to make sure that we are on the same page and that we are not missing any pieces that we should be thinking about for our response, recovery, all parts of our EOC operation. We're making sure that we are touching base with all of our partners, both government and non-government partners, to make sure that we are preparing our community.
Now, Katie, I noticed that in all the videos, everyone's wearing different colored vests, and the city's Emergency Operations Center is set up under the Incident Command System under an ICS structure with different sections. Can you talk about some of the different sections, such as operations, planning, finance, logistics, and our management section, and how we're very fortunate in Newport Beach to have this center and have the center with multiple rooms for these different sections to operate, and how we operate under an all hazards approach? Although this is a pandemic-based incident, whether this was a fire, flood, an earthquake, any other type of incident in the city, we still operate under the same incident command system principles and operating guidelines.
Well, I think it's important to note that all city employees are disaster service workers. So all employees who work in government agencies at any government agency or the state are disaster service workers. So by law, we're required to report back during a disaster. So our Emergency Operations Center does operate using the incident command system, which is the industry's best practice, and we adhere and apply all California Office of Emergency Services as well as the Federal Emergency Management Agency best practices, and that's how our EOC is set up. So how we're set up is we use those 5 standard sections. So we have finance and logistics, planning, operations, management. We have different employees that fill those different section roles based on their expertise. For example, our operations section is staffed with police, fire, public works, harbor patrol, utilities. Those are the people out in our communities that are the doers, the operators. So their role in the EOC is to support those field operations. Then we always need someone behind the scenes making plans, logistics, supporting all of the equipment, needs that we need out in the field. So our Emergency Operations Center is all hazard based. We plan for everything, but our essential why we activate is to support our field operations and our field staff that are out in the community, as well as the community itself. So long after the COVID-19 EOC activation, this room will still be operating to support those long-term community needs. So the financial long-term needs. Part of the process during COVID-19 is working with the state and FEMA and talking about how the city can recoup some of those preparedness costs and response costs during COVID-19. So our EOC will be continually working to make sure that we get those financial documents and information back to the city of Newport Beach, as well as those long-term community responses. We'll be working with the schools come September. If schools are able to open in September, we will be working, the EOC will be coordinating with those schools to make sure that we are doing and working as safe as possible in the city of Newport Beach.
So Katie, I know this COVID-19 thing has been going on for quite some time and will continue through, and the Emergency Operations Center will be up up and running really through the summer and the fall to really assist the city with all the different things that we're planning for. But I imagine it's not the only thing you're planning for. We have a wildland fire season that always starts in late August and goes through really the entire year. What are some other things that you're concerned about that we could have really spring up here in the summer and the fall?
Absolutely. Prior to COVID-19, we actually were working on an exercise with the cities of Laguna Beach and Irvine to conduct a wildland exercise between the three cities. We know that we haven't had a large wildfire in a long time in Orange County, I think since 2009, so we've always been planning for that. What's interesting is during COVID-19, we've had a swarm of earthquakes as well. So Mother Nature is not taking a break during COVID-19, so we're still planning for during COVID-19, if we should have an earthquake, if we should have a wildfire, the city has to respond to all emergencies and disasters. So while our primary focus is on COVID-19 right now, we are still planning and focusing and forecasting ahead and what the city needs to be looking at for other emergencies and disasters to respond to. Our city's EOC will remain activated after the COVID-19 health restrictions are lifted so we can continue to support the Newport Beach community, small businesses, schools, and to make sure that we are actively engaging in the social distancing requirements, rules, whatever we can expect in the future to make sure that the Newport Beach community is prepared and safe. While COVID-19 is the current emergency and disaster, here in the city's Emergency Operations Center, we are also looking to the future. We also are continuing to monitor earthquakes, fires, tsunamis, any other type of natural disaster that we could be impacted in the city of Newport Beach. So we remain activated and we remain vigilant for any health or natural disaster that should impact the city of Newport Beach.